Right. Well, I think, again, bringing in the context of the pandemic, it's changed the way we practice, and it has created new challenges for health systems, for health organizations, for professional bodies, for our practices, and indeed for ourselves personally, as we've all been impacted by this. I think we have an excellent track record and EQIP of outputs in many areas, including health equity and inequity, in patient safety, professional health, teaching quality, measuring quality, and e-health. And we have an EQIP Council meeting approaching, where we will begin the work to reassess and reframe our work plans for the next few years. And there is likely to be some interruption of projects, but also some shifting between the working groups and the projects to align ourselves with the current needs of the membership of EQIP. So we need to listen to the current needs of the membership in EQIP. Of course, everything that we do is under the umbrella of quality. I think at this point, I'd like to outline three particular areas of interest that I feel require particular attention. And then I'd like to mention one area which is an overarching area that has become important and we have all become concerned about, and I feel we need to incorporate it into our work plans also. I think for me, this first topic involves professional health and well-being. Healthcare. And the healthcare we deliver is dependent on human resources. We need good human resources and healthy health workers to make decisions, to care for and to support patients. So it's about making decisions, caring for and supporting patients. And I think COVID has taught everybody, health professionals and patients alike, to have a deeper recognition of the impact of delivering healthcare under the circumstances of the COVID pandemic. And our conditions of employment in the health sector have received attention during COVID. And I feel we need to build on that. But much of the literature, international literature in the past 2 years, has highlighted the impact of the pandemic and on work in the healthcare sector on our hospital colleagues. I feel we need to focus specifically on what these work conditions mean to health professionals in primary care. We need data and we need interpretation of data, and we need to gather feedback from primary care professionals. We're very proud of our EQIP colleagues in Ghent, in Belgium, who've taken the initiative on this with the pre-COVID study. And I'm sure we're going to hear a lot more about that in the coming years. The second area that I would like to focus on will be on safety. That's safety for patients and for professionals. And that approach to safety in primary care must be bidirectional. Of course, no professional goes to work any day with any intention to cause any lapses in judgment, but lapses in safety will happen. And that will happen due to many factors, system factors and human factors, patient factors. It's acknowledged that there can never be 100% guaranteed safety in healthcare. Healthcare is full of uncertainties, with time pressures, with high volume workloads, and all of these have scope for lapses and lapses in communication and organizational issues. So all of these players must be alert to opportunities for clinical risk management. And our EQIP colleagues in Spain and in France have been particularly active in safety in primary care and in practice. And our EQIP members have been in leadership positions in the WONCA World Working Party for Quality and Safety for a number of years. And so are many of our other EQIP members active in this area. For the third area that I feel requires attention, this is e-health and telemedicine. Again, another area of rapid change and development in primary care, and our EQIP colleagues in Finland and in Denmark have made enormous progress in this area in recent years. And I think, lastly, the other area that's emerging globally as a very important area, and in particular for general practice, family medicine, is the area of sustainable healthcare, planetary healthcare, and lifestyle medicine. We said we've been very active in EQUIP. We have a lot of outputs on research and teaching, and we need to combine of these strengths and discuss them in the upcoming council meeting and beyond, and look at strengthening our work outputs on translating quality improvement into practice outputs, and to advocate for GPs to ensure that these quality improvement initiatives have relevance and practicality on the ground.